Hello everyone. Today in this video we are going to discuss the abdominal aorta and its branches. Myself Dr. Ankit Khandelwal, MBBS and MS in Anatomy. This is my YouTube channel Anatomy Explained. So moving on to the topic that is our abdominal aorta. Abdominal aorta. Now, abdominal aorta is a continuation of the thoracic part of the aorta. So as the aorta passes from the heart as the ascending aorta, it takes a loop which is known as the arch of aorta, and then it goes behind into the posterior mediastinum as the descending thoracic aorta. It enters the abdominal cavity by passing behind the median arcuate ligament. So you have a median arcuate ligament. This median arcuate ligament is between the two crusts of the diaphragms. So as we talk of the thoracoabdominal diaphragm, so thoracoabdominal diaphragm is connected behind into the lumbar vertebrae, that is your L1, L2, L3, the upper lumbar vertebrae. On the right side, it is known as the right crus of diaphragm is attached to the upper 3 lumbar vertebrae. On the left side, it is attached to the upper 2 lumbar vertebrae. And between these connections, these are known as the crus of diaphragm. They form a thickened fascia above, and that thickened fascia is known as your median arcuate ligament. That thickened fascia is known as median arcuate ligament. So just above the L1, that is around the level of T12, it is the aorta which passes behind this median arcuate ligament in the form of abdominal aorta. So you have the aorta above, that is a thoracic aorta. Now it will pass behind this median arcuate ligament, and that is the starting point of our abdominal aorta. Now abdominal aorta, it is not directly in the midline, but it is lying slightly left of the midline, that is slightly left side to the vertebral column, and then it descends down. It descends down up till the L4 vertebrae. So you have around below L3, you have this L4 vertebrae. So this abdominal aorta is going to descend down from T12, around T12 it will go down, and around the L4 vertebrae it is going to bifurcate into two common iliac arteries. These are your two common iliac arteries. So it bifurcates into two common iliac arteries at the level around L4. So if you talk of the course of the abdominal aorta, the abdominal aorta vertical course is from T12 to L4. That is the roughly course of this abdominal aorta, where in the anterior on the posterior side it is close to the posterior part of the abdominal cavity, that is close to the left side of midline at the vertebral column. So this is the course of our abdominal aorta. Now there is also a vessel which is running to the right side of the abdominal aorta, and that vessel is collecting the blood from the lower part of the body, and that vessel is your inferior vena cava. That vessel is your inferior vena cava, also known as IVC. So it is collecting the blood. So direction of blood in IVC is from below upward, and the direction of blood in the aorta is from above below, that is upward to downward. So that is the direction of blood. So what is this aorta carrying? It is carrying the oxygenated blood, and the IVC is carrying obviously the deoxygenated blood. So these two vessels are not very far from each other, and they are one of the major vessels present in our body. So abdominal aorta, the course is from T12 to L4. Now few applied parts on this abdominal aorta, we can have a knowledge of that also. Abdominal aorta, it will give off various branches, but first of all, the applied part of abdominal aorta is a very common problem, that is said to be the aneurysm of the abdominal aorta. Aneurysms are the localized areas where the wall of the vessel, it dilates or is thinned out, and it dilates. So that area is known as aneurysm. The main trunk of the abdominal aorta may get aneurysm, and that is normally below where the abdominal aorta gives off the renal branch. So that is known as the infrarenal part of the abdominal aorta. So how we are going to understand it? See, first of all, we should know that what is the normal diameter of the abdominal aorta. The normal diameter of the abdominal aorta in males is roughly around 19 to 21 millimeter, and in females it is roughly around 16 to 18 millimeter. So mean is around 20 millimeter in males and around 17 millimeter in females. The cutoff limit is taken as around 3 centimeter diameter. So if it is more than 3 centimeters, normally is some aneurysm. Now there are various stages of aneurysm that is better dealt in the surgery part. So normally the abdominal aorta, which lies from T12 to L4, at around the L2 level, where it will give off the renal artery, below that it can dilate, that is known as aneurysm. The cutoff limit is around 3 centimeter, and the normal diameters are these. Now below L2 level, there is also one more applied, that is known as aortocaval fistula. This is known as aortocaval fistula. So what happens in cases of abdominal aneurysms? Below the level of L2, below the level of L2, there could be sometimes a rare complication of the aneurysm, that is a aorta and the IVC may develop a small fistula with each other because they come close to each other. The IVC on the right side, the aorta on the left side, they come close to each other below L2 and they may form a small fistula. So that is a rare complication. Now let us see what are the various branches given off by the abdominal aorta. So the major thing is how to remember these branches. To remember the branches of any artery in our body, you need to know a few things. What? That's first of all, it is just a vessel. It is just a pipe, it is just a tube which is carrying the blood and it will supply to the adjacent areas. So for that you need to know what is the course of that particular artery. So from which area that artery is passing, it will be supplying the structures which are around that area, which are around the course of that vessel. So as we know that this abdominal aorta is passing through the abdominal cavity, the range we know that is from T12 to L4, so it will be supplying blood to those parts. What are those parts? First of all, it will be supplying blood to the abdominal wall, because you can see that it is lying close to the posterior abdominal wall, so it will supply blood over there. Second, it will supply to the blood to the organs or the viscera which is inside the abdomen, so it will supplying blood to the viscera which is lying in the abdominal cavity, so for that we also need to know that what are those visceras. The visceras we know in the abdominal cavity we have the gut region, so it will supply the gut part. Gut, if we know that is divided into foregut, it is divided into midgut, and it is divided into hindgut. So these three parts of the gut embryologically are different. So these three parts of the gut will be supplied by three separate branches coming from the aorta. What else lies in the viscera? In the abdominal viscera, apart from the gut where you have the whole digestion process taking place, apart from this we have few organs as few glands over there which are apart from the viscera. These few organs will be our kidneys. With the kidneys we have the adrenal glands or the suprarenal glands, endocrine glands. And developmentally you also have the development of the genital organs from this area only, then they have to descend down, so you have the gonads also which embryologically arise from that area. So abdominal aorta will be supplying branches to the gonads also. So first of all we should be knowing, before learning what are the different branches, that what area does it supply. That is the abdominal aorta. It supplies the abdominal wall, so it will give off branches to the going to the wall. To supply to the viscera the three parts of gut and whatever their diverticulums are. For example, in the foregut we have the hepatic bud and the pancreatic bud coming off, so it will also supply the liver and the pancreas and extra hepatic biliary apparatus, that is all the gallbladder and the ductal system. Apart from that, it is also going to supply one more organ, that is spleen, which is not a part of the gut but it is very closely related to the gut. Spleen is closely related to the liver, the splenic vein and going into the liver as a portal vein. So spleen also will be supplied by the vessel abdominal aorta. Then the organs, the kidneys, the adrenals and the gonads. Over here we can have a rough idea beforehand going into the branches, that these organs are pairs. They are in pairs. So we have two kidneys normally, two adrenals, two gonads. So these organs are in pairs, so their arteries have to be paired ones. The foregut, midgut and hindgut, these structures are unpaired. You only have a single stomach, you have a single intestine, so obviously they will be the arteries will be unpaired over here. These abdominal wall normally, because the artery is in the midline, you have the right side of the wall, you have the left side of the wall, so common sense is that the branches which will be coming from the abdominal aorta, they also have to be normally paired to supply the abdominal wall. So if we understand that these three areas, one is the wall, one is the viscera, the gut part, and third when we can see the organs, they are our target areas. So now we can easily go to what are the various branches coming on, at what levels. So as we said that okay, it is passing behind the median arcuate ligament. So imagine this is a median arcuate ligament and that vertebrae level is T12. So if we try to make the vertebrae over here, that this supposedly would be the level of say T12. Below T12 we have this as the L1, then we have this as the L2, then we have this as the L3, and finally we have this as the L4. We can make L5 also over here. And we just said that okay, the aorta, the abdominal aorta, it passes behind this median arcuate ligament. Let us name them also T12, L1, L2, L3, L4 and L5. So now coming onto the aorta, it passes behind the median arcuate ligament at around the level of T12. It will go down like this, slightly to the left of midline, slightly to the left of midline. So it will going down like this, and at around the level of L4, around the level of L4, it bifurcates into two common iliac artery. So this is your abdominal aorta over here, lying in front and slightly to the left of the midline of the vertebral column. Now coming to its branches. Now how to learn its branches? So first of all, let's start sequentially. That is, if we start with say the branches to the gut part. So gut part, we said the gut part will be supplied by unpaired branches. So these branches going to the gut will be unpaired, and these will be visceral branches going to the viscera. So unpaired branches to the viscera are three: foregut, midgut, hindgut. For the foregut, we have the celiac trunk. So that celiac trunk normally comes from where? Celiac trunk is coming from around T12. So when the aorta, abdominal aorta starts, just below it, around the T12, or you can say the lower part of T12, you have the origin of the celiac trunk. So this is your celiac trunk. So it is an unpaired branch, celiac trunk. Which gut? Foregut. Now going slightly below, because after foregut comes the midgut, you have the next artery, that is a superior mesenteric. Remember, all these are unpaired. So superior mesenteric artery, if you remember, it comes from the transpyloric plane, that is around the lower part of L1. So you can say from lower part of L1, again unpaired, this will be our superior mesenteric artery, artery for the midgut. Then around the L3, it will give off the third unpaired visceral to the hindgut, that is our inferior mesenteric artery, that is to the hindgut. So these are three unpaired, supplying the foregut, midgut, hindgut, and their derivatives, which includes the liver, the pancreas, and also the spleen. The spleen being a lymphatic, but it will be supplied by the branch of the celiac trunk. So these are three unpaired branches. Now we go from this unpaired branch. Say now we go to the branches which are going to where? Which are going to our glands and the organs. Glands and the organs which are over there. So what are those glands and organs? We said, okay, we have the kidneys, the adrenals, and the gonads. So the artery which will be coming from here, let us make them with this blue color just to avoid the confusion. Around the level of SMA, which is at the, you can say the lower part of L1, arises the middle adrenal or middle suprarenal artery. So middle suprarenal artery will be these will be paired now. So this will be a middle suprarenal. I'm just writing over here. That is middle suprarenal, or we can also call it as adrenal artery, middle suprarenal artery. And just below it, you will have another pair. Now this thick would be your renal arteries. These would be your renal arteries over here. These are, remember, these are for the glands, organs, and always remember these are the paired ones. They are lateral branches. And below this, around L2, you will have, because the gonads also develop from here. You can see the embryologically the gonads and the urinary system, they are coming from the intermediate mesoderm. So gonads also develop somewhere around here. So around the L2, it will give off the gonadal arteries. So these will be the gonadal arteries. In males, we call them as testicular artery. In females, obviously, we call them as ovarian artery. We call it as ovarian artery. So these will be the three paired form going for the gonads or the glands. Now what are we left with? We are left with one more set of branches which are going where? Which are going to the abdominal wall. So there's one more set branches, third, which is going to the abdominal wall. As we have seen that the aorta is lying posteriorly, so obviously the posterior abdominal wall comes first. If you go to the topic posterior abdominal wall, there's a diaphragm also which is forming a part of the posterior abdominal wall. So what are the various branches which are going to the posterior abdominal wall? Let us take this yellow color. Okay, so yellow color for this posterior abdominal wall and the abdominal branches. As soon as the abdominal aorta starts, it gives off the inferior phrenic artery, which is this artery. This artery is our inferior phrenic artery. So as you can see that the diaphragm is above it, so it will be supplying diaphragm from below. So the name is inferior phrenic artery. Again, to the is like paired one. So these are the posterior abdominal branches. So they will be lying posterolaterally. They will be rising from aorta posterolaterally. Okay, so laterally you have the paired branches going to the gland organs. Anteriorly you have the visceral unpaired. These are coming from the posterolateral part. So this is your inferior phrenic. Now as we have seen that the abdominal aorta lies in front of which lumbar vertebrae? Not all, only L1, L2, L3, L4. So it will be giving off these four pairs of lumbar arteries. These will be your four pair of lumbar arteries. These will be a four pair of lumbar arteries, and they are in continuation with the intercostal arteries, which we have done a video on the thoracic wall and thoracic cage. So those posterior intercostal arteries used to come from abdomen, from the thoracic aorta. So thoracic aorta above the diaphragm giving off posterior intercostal. Right in continuation to that, the abdominal aorta in the abdomen will give off the lumbar arteries. So these are the lumbar arteries over here. Upper 4 from L1 to L3, L3, L4, upper 4. Again going to supply the abdominal wall. Now again there is a posterior branch but that is unpaired. So these inferior phrenic and lumbar, they are paired, but there is one more artery just above the bifurcation arising posteriorly. This is your median sacral artery, which the name of this is median. N is midline, so it is cannot be impaired, it is midline unpaired. Median sacral artery. Now it will be obviously going down. Why the name is median sacral artery? Median, midline, single, unpaired. Going below, what is below L4, L5? Then what is below L5? You have the sacrum bone over here. So it will be lying just in front of the sacrum, known as median sacral artery. One thing is missing. That is the aorta is giving off the 4 pair of lumbar arteries. The L5, the 5th lumbar artery, can come from the median sacral artery. So this median sacral artery can give off the L5, or you can say the 5th lumbar artery. Okay, if it is if the 5th lumbar artery is not, 5th pair of lumbar artery is not coming from the median sacral, it could be also be coming from the iliolumbar artery, which is a branch of the internal iliac posterior division. That is the artery which is below. So this is basically how do we remember the branches come from the abdominal aorta. So you have to first remember that what is the whole course of this artery, which area is it passing, what are the surrounding structures. You have the wall, you have the organs and the viscera, so it will supplying this. Viscera are not in pair, so unpaired artery. Organs are in pair, so paired artery. Wall is on the right and left side, again paired, except that there is a median sacral. For sacrum again is unpaired, it is going right in front of the sacrum. Okay, so this is normal learning how the branches of the abdominal aorta and how to learn them. Now there could be few variations over there, so let us discuss a few variations which are important clinically, because every time it is not that in all the individuals the branches will be like this only. There could be few variations. Now let us see those few variations. As we saw that the artery of the foregut, which was our celiac trunk, normally divides into 3 branches. Those 3 branches are our left gastric artery, then we have the larger one known as the splenic artery, I told you spleen, and then we have the common hepatic artery. Okay, this was the unpaired, and the one paired above the celiac trunk was your inferior phrenic artery. So you can imagine that both are coming from around the same level, that is T12. So both origins are very close by. So this is not a very uncommon variation if you see that inferior phrenic artery is coming from a common trunk as the celiac trunk. So there could be common trunk, and that is celiac trunk, inferior phrenic artery can come from that. So that is one variation. Second variation could be that the left gastric artery could come as separate from the directly from the abdominal aorta. Could come as separately from the directly from the abdominal aorta. Okay, so this another variation. Now below the celiac trunk we had the artery of the midgut, and what was that artery? That was our superior mesenteric artery. Superior mesenteric artery for the midgut. The superior mesenteric artery is not very far off from the celiac trunk. Remember, celiac trunk was around the lower part of T12, or you can say T12 L1 junction, and the superior mesenteric artery is around L1 or lower L1. So there's hardly 1 to 2 centimeter gap only between these two arteries. Therefore, few branches of superior mesenteric artery, few of its branches may come from directly from the celiac trunk. Common variation, not a big deal. So this is one variation which you can see around the celiac trunk. Another variation is that celiac trunk, as it gave off the common hepatic artery, so it will give a few other branches that will do some other day, all the branches subsequently. But over here the name is hepatic, so it will be giving off branches to the liver. So there are 2 hepatic arteries, the right hepatic artery and there is a left hepatic artery. So because there are 2 lobes of liver, right and left hepatic arteries are there. Now, there is a very common variation, very common variation, that this right hepatic artery at times may be absent. Absent means it is not coming from the common hepatic artery. This right hepatic artery may come separately either from the aorta itself, or it may come from the superior mesenteric artery. Not a very uncommon variation. So when it is come from the superior mesenteric artery, we can say that it is an accessory right hepatic artery. So right hepatic artery could be accessory right hepatic artery, or it could be replaced right hepatic artery. What does it mean? It means that if there is no right hepatic artery from the common hepatic, we call it as a replace, because it has been replaced from there, coming from the superior mesenteric. If there are two right hepatic arteries, one is from the common hepatic and one is from the superior mesenteric, we call it as an accessory right hepatic artery. Not very uncommon, seen in around 15% of individuals, so not a very uncommon phenomenon here. Okay, so these could be few common variations on the celiac trunk, inferior phrenic artery, and all. They can be coming up from the celiac trunk. Celiac trunk branches, left gastric may come from as a separate branch of aorta. This right hepatic may come separately from the superior mesenteric. And when this is also a very important point, when this right hepatic artery is not coming from its original location but from the superior mesenteric or separately from the aorta, in that condition, please note down, in that condition, the right hepatic artery, it passes posterior to the portal vein. So that is very important while doing surgeries and all. The location changes, because normally the hepatic artery lies in front of the portal vein, slightly to the left side, or basically anterior to the portal vein. But if it is coming directly from the aorta or the superior mesenteric artery in the form of accessory or replaced, in those cases, the right hepatic artery will be found posterior to the portal. And so that is one another variation that could be that could be a result of the variation of the branches of the abdominal aorta. So this was the basic idea on all the branches of the abdominal aorta, all the branches. Subsequently at L4 it will divide into two common iliac arteries, and this is how we can remember the branches of the abdominal aorta. Okay, so just go to the basic concepts and then it will be simple. So if you like the video, you can go like. If you are not yet subscribed, you can consider subscribing it. And also one more thing is I also take classes in Unacademy. So they are my live classes in Unacademy, which are both special as well as free classes as well as in plus courses. So in Unacademy also you can join to look at my further live classes. Even the recording classes are out there. So this is the course which is running on right now in Unacademy. You can go to unacademy.com. In that there is a neat PG platform, and you can search my name over there, Dr. Ankit Khandelwal. There's a whole list of classes going on. So there are few plus classes, so plus batches going on, and there are few special classes also going on, which are open for all. These are live classes, and there's a Telegram group. The link will be there. YouTube channel, which you are seeing right now, and this is also the Unacademy also have their Telegram as well as the YouTube channels. So this was all about the video. I hope you enjoyed it, and we'll coming up with the other few parts of the abdomen in the further coming up videos. Thank you so much. Myself, Dr. Ankit Khandelwal, Anatomy Explained.